Today I'm meeting Sean, and he's had these growths for almost 25 years.
Got several of these here on my arm. This one hurts.
Is it both arms, mostly your right arm, or?
I have one here.
Okay.
And it started out slowly and then began to protrude more and more. These two, they've gotten larger.
Anything happen before they come out? Like, do you remember injuring yourself?
I did talk to one doctor, potentially from playing sports.
When someone injures a fat cell just in a certain way, those fat cells start to multiply. Did he ever do a test then to follow up?
He was the one who said, okay, they're calcium deposits, and they wanted to remove it entirely. Nobody's really dug into this.
When I first looked at Sean's, I thought to myself, this could be as simple as just a benign lipoma, but it could be a parathyroid disease where calcium is depositing, which is really dangerous. This is pretty mobile. What was kind of striking was that they're actually pretty large. And you said this was a little bit more painful. This is a 5-centimeter spot. The first thing I ordered was an imaging study called a CT scan to just get a better sense of whether they actually are calcified. Also, do they have a malignant look to them? Of course, we would do some blood tests as well. The one thing that's a really helpful tool is doing a biopsy and looking at why you're getting these. Once I did the biopsy, immediately I could see that there was a globule of yellow fat cells percolating at the surface of the skin.
We're joined by dermatologist Dr. Sonia Batra, who agreed to take on this medical mystery case. How bad was his case?
So it was a pretty severe case in that he had a number of spots and they were pretty big. So I think that made it a little bit more challenging just to diagnose.
And how did you ultimately come down to your diagnosis?
So because there was this question as to whether they were actually calcified, after I saw him, the first thing we did was order an imaging study to see if there really was calcium under the surface of the skin and just kind of gauge, like, how benign did these look? Are they fixed? Are they communicating with the underlying skin? And fortunately, right off the bat with the imaging study, there was no calcification. So that was really reassuring and nice to know. The other question about the calcification is that if someone really does have that, we worry about kidney disease, we worry about issues with their parathyroid hormone. So we did do some blood tests as well, and fortunately his calcium, his phosphate, his kidney function, all were completely normal, which was reassuring.
So the overall health problems you were worried about, you ruled those out, which is all great. So of course it begs the question, the most important one is treatment and what's available.
So then we did finally just do a tiny little punch biopsy just to make sure that once we knew from the imaging study that they looked benign, they looked like they were based in the skin, but we just wanted to know the cell type. As soon as we did the biopsy, right then and there, we could see they were lipomas, which is just really benign growths of fatty tissue. And so he just had kind of larger ones and a large number of them. So we talked about his treatment options because we could see what it was, and the tissue pathology confirmed it. But they really are much more conservative than what he had been told. So rather than doing the big, large surgical excisions, he did small. We could do one of 3 options. We could do small keyhole incisions where we do them under local anesthetic and take them out. We could do liposuction to remove them. And there's even a new injection that is now being used elsewhere in the body to dissolve fat, and that might even be applicable to these. But really, he doesn't have to have them treated. They're completely benign. If he opts to live with them, it's totally fine as well.
But he has answers. He has options, thanks to you, Dr. Batra. Always a pleasure. And I know that cracking the case to his mystery was an important part of the puzzle, but we're also going to send Sean to Dr. David Ozog, a renowned dermatologist at Henry Ford Health Systems in Detroit. He has agreed to evaluate Sean's case based on Dr. Batra's findings and come up with an appropriate treatment plan. We're going to be checking in with Sean later in the season to see how he's doing. Best of luck to him.